Hey everyone, and welcome back to Friska AI Voices, the podcast where we bring you the people, purpose, and passion behind Friska AI. I'm your host, Harshita Gupta. In today's episode, we are diving into a powerful topic, the relationship between patient wellness and practice revenue. Can doing good for the patient also be good for the bottom line? To unpack this journey, I have joined with a special guest, Doug Stewart, our Vice President at Friska AI. Doug, welcome to the show.
Thank you very much. Looking forward to it.
Okay, let's start with the big picture. How do you see patient wellness and practice revenue being interconnected in today's healthcare ecosystem?
Yeah, it's interesting because the primary structure of America, the United States healthcare ecosystem is centered around what people call payers or insurance companies. So insurance, pretty much an insurance reimbursement, which is really collective bargaining for reimbursement, drives everything. Most countries in the world have some form of nationalized healthcare, but I would actually submit that the United States is about halfway there. And if you look at a typical health plan and what their population looks like, if it includes state governments, local governments, and the federal government, about half of any plan's population is actually some form of government entity. That would include Medicare and Medicaid, which are growing markets right now. I think right now about 11,000 people a day age into Medicare. And I bring that up because overall, the health of the population is getting older and the outcomes are getting worse. So the challenge for our practice is, how do I accommodate the reimbursement that an insurance company is going to provide me, but still be able to make revenue for my practice? And many practices struggle to do that. But that I think is what's unique about what we've done here. And I'm sure we'll talk about that a little bit later.
Okay, so I think it comes to our philosophy that Friska AI is built on the idea that doing good for the patient can also be good for the practice. Can you share how we have structured Friska AI to create this dual win?
Yes, but I'm not going to give away any trade secrets. So what's really interesting about the way this system is set up, and when we talk to physicians about it, they're a little bit surprised because we talk about all the patient engagement features, engaging people in diet changes, custom nutrition plans, lifestyle changes, fitness, and lots of engagement with the customer and tons of features. And they always ask us, okay, great, how much does that cost? And that's the great question for me, because we say, no, you don't understand. We pay you. Like, our program actually drives revenue to your practice. And though that's sort of financially appealing to the doctor, and they're confused and they want to understand, so how does that exactly work? I think fundamentally the interesting thing it does is, number one, it gets the doctor excited about it, because if the physician's not going to recommend this program to their patient, it all kind of falls apart. We only want the physicians that are excited to participate in this. And frankly, a lot of physicians that we've talked to are sick and tired of talking to their patients about diet and exercise. They feel like they've done it 100 times for years and years and no one ever listened, so they give up. And I've heard that directly. And that's a human being thing, I think. The second part of it that's really interesting, though, is because the physician financially benefits from it and their patient benefits from it, our incentives are entirely aligned towards patient engagement and results. And I think that's the most interesting thing. So people at our company aren't working, they're not worried about billing, and they're not worried about invoicing doctors and all of the mechanics around sort of the healthcare system in the US. We're really focused on, how do we do better engagement? How do we make the experience better? What else can we bring to the table to add features, to add value and understand sort of people's health journeys, and then what their motivation model is to change, so that we can help sort of foster positive behavior change. And frankly, we do that between the doctor visits. So we're sort of the advocate of a healthy lifestyle between doctor visits. And then when they come back, they look at a dashboard and they can see, well, what's this person's activity level like? If they're diabetic, what is their glucometer results? And you start to get an idea of this repeated journey towards health. And I think one of the most important things towards influencing any type of behavior change, maybe most importantly, is persistence of message. Is you need to
Correct.
have the same message again and again and again and again. And I think
Yeah.
some people psychologically are like, well, I guess this isn't going away. This isn't a comment made to me by a physician, 3 years ago that hasn't come up since. This is something that not only I need to participate in, but when I come back to my doctor, they're going to give me, they kind of have a report card a little bit of like, well,
Yeah.
how are you doing? How else might we be able to help? Is there anything else that we can do? And the second part of it is just having somebody as an advocate for you is a big part of this.
Yeah.
It sort of feels like sometimes when you're trying to change behavior or trying to adopt a healthy lifestyle that there's a lot against you. And simply having somebody in your corner who's a coach, an advocate, an ally, who's truly there to help, it makes a big difference.
Yeah, that's true. Like, I totally get it. Like, it both benefits to patients as well as to the practice owners. Yeah. So, moving forward, traditionally, revenue generating tools are often seen as non clinical. What makes Friska AI different in the way it brings clinical value and financial return?
It's the model itself. So lots of companies have used artificial intelligence as a marketing buzzword. And I think most executives and people who are looking for innovation in this space are almost past the peak of the hype cycle using AI. And I think the unique thing about what we've done is we've used AI not to create new features and bells and whistles, which we certainly have done. We used it to create an entirely new business model that I haven't seen anybody replicate. And that is you sign up for the program, you drive practice revenue, and you drive beneficial results for your patient. And it's based on the most fundamental of premises, right? Which is one of the best things to do to improve your health is diet and exercise. I mean, that goes back to Hippocrates, I think about 400 years before our calendar even started. It's a well-known fact, but somehow we've lost that in sort of the busyness and the complexity of today's healthcare model. So in some ways it's simple, but I really think the innovation is the business model associated with it, and it aligns all the incentives very, very well.
Yeah. So, from a practice success point of view, what kind of data or results you seen that improve this approach in working, and both patient health comes and practice economics are getting better? Like, you can share.
Yeah, it's what you can see, and we talk about this with doctors frequently, is it in an entire patient population, you are not going to be able to change the results for everyone. You simply
Yeah.
aren't. There are some people that do not want to be influenced, but what surprised a lot of physicians, I think, number one, is the number of people who actually do want positive behavior change. And you start to see these rounding of results that show improved HbA1c levels for diabetics and glucometers, improved activity, less weight, better diabetes management, less medication. That doesn't even get into the financial aspects of this for patients. But part of the problem is this problem in the United States is getting worse and worse and worse. And we focus on sort of treating people with chronic conditions. 60% of the people in the US have one chronic condition, and 40% have more than one. And the expectation is that that number is going to double by 2050. So we're really fighting an uphill battle. It's a little bit of a moving target, but when you look at the patients that were able to engage in Friska, you see definitive results. In the short term, you see it at better glucose management, more activity, better health and lifestyle, better weight management. People will either plateau with their weight or start to lose weight at a regular pace. And it's a journey. This is not There's no silver bullet to this. It's instituting behavior change takes time. And once you get people engaged and get those behavior changed, our goal is to support it and to continue it so that we can help make that behavior change more permanent and more lasting. I mean, everybody can develop a good habit.
Yeah, that's true. So, what would you say to a provider who's still skeptical, someone who sees patient care and revenue as a trade off rather than a synergy?
It's a good question, and I've had this asked to me a number of times. From the revenue perspective, I usually say if you can find another investment where you can put $0 into it and get a 30% return, let me know what it is because I'll invest my own personal money in it and I'll do it all day long. So the financial one, the fact that we make this free for the physicians is a huge component of this. Um, the second part of it is really the patient wellness, and I think sort of metering the expectations that not everybody is going to be changeable. Not everybody is going to be treatable by this course of action. And in many cases, when physicians have given up or even are getting requests for certain medications from their members. We advocate that partnering health and exercise with certain medication prescriptions is actually beneficial as well. So it doesn't have any form of negative impact on the provider and really does help out the patient substantially.
Mhm. Okay. So, let's that was a very nice interview that we could talk about it. And